A doctor in Ohio is part of the team which helped conduct recent clinical trials on the first non-hormonal medication to fight night sweats and hot flashes. He sat down to talk exclusively with medical reporter Liz Bonis for today's Medical Edge.
Dr. David Portman is a gynecologist who helped conduct recent clinical trials on a medication about to hit the market called Brisdelle. It contains a lower dose of paroxetine, a medication already used to treat mental health concerns, including depression. Brisdelle is the first medication approved by the Food and Drug Administration that is non-hormonal to treat hot flashes and night sweats.
They occur typically in the early part of menopause, around 50, 51, give or take a few years. Women feel a sense of warmth, often accompanied by perspiration. A severe hot flash makes them stop what they're doing.
1,200 women participated in 2 trials. Half had the actual study drug, the other a placebo or pill without it.
Patients had close to a reduction of about 5 hot flashes per day from baseline, and 1 to 2 different than placebo.
So did you actually look at both severity and frequency of the hot flashes?
We looked at number and severity. So frequency was calculated by counting, and severity based on the way the woman graded her hot flash. Was it mild, moderate, or severe? And there were reductions in both the frequency and severity.
Dr. Portman says those reductions appeared to last during the trials, in this case up to 24 weeks.
Since the trials were conducted for a shorter length of time than a woman might be on the medication, he does suggest that you start with some lifestyle interventions. He says many women can reduce both severity and number of hot flashes just with a couple simple ideas.
Those ideas include dressing in layers and avoiding triggers with hot flashes such as spicy food, alcohol, or hot beverages.
If patients can avoid those kinds of triggers and get their symptoms satisfactorily treated, then they can perhaps avoid a medication.
If not, he says, you can ask your doctor about this newer option, expected to be on the market by the end of the year. Liz Bonis, Local 12 News.
Now, headache, nausea, and fatigue were the most common side effects reported in the study, and those did go away within about 4 weeks. The clinical trials were funded by Novan. That's the company that developed the drug. If you'd like more information on the medications, go to our website at local12.com. Let's turn